The only limit to our realization of tomorrow will be our doubts of today. This video introduces trachoma, the leading infectious cause of blindness worldwide, and how it is managed. Trachoma's name comes from the Greek word trachis, meaning rough eye. It is defined as a chronic, contagious keratoconjunctivitis caused by bacteria and results in preventable blindness. Globally, trachoma is hyper-endemic in poor rural areas across the tropical disease belt. India, which was previously highly endemic in the north, was declared free from infective trachoma as a public health problem by WHO in 2024. The causative agent is Chlamydia trachomatis, an obligate intracellular bacteria containing both DNA and RNA. It is sensitive to antibiotics like sulfonamides and macrolides. Inclusion bodies, known as Halberstader Prowazek, are found in conjunctival cells. The serotypes of Chlamydia trachomatis responsible for trachoma and subsequent blindness are A, B, A, and C. Chlamydia trachomatis is the causative agent, and trachoma means rough eye. The serotypes causing trachoma are A, B, and C. Trachoma is the leading cause of infectious blindness. Trachoma spreads through direct eye-to-eye contact with discharge, or indirectly via shared items called fomites. The vector is the musca sorbens, or eye-seeking flies, which carry discharge. Transmission can also occur from mother to child. Risk factors align with the epidemiological triad. Infection usually begins in infancy or childhood. Women are blinded more often due to childcare contact. Environmental factors include water shortage, flies, overcrowding, and poor sanitation. Pathogenesis involves repeated infections leading to chronic conjunctival inflammation and follicle formation. This causes scarring, which turns the eyelid inward, known as entropion. The eyelashes then rub the cornea, called trichiasis, resulting in corneal opacity and eventual blindness. The WHO uses the FISTO grading system with 5 stages: TF for follicular inflammation, TI for intense inflammation, TS for scarring, TT for trichiasis, and CO for corneal opacity. TF, or trachomatous inflammation, follicular, is characterized by 5 or more follicles, at least 0.5 millimeters in size, on the upper tarsal conjunctiva. This indicates active infection, common in young children, and requires treatment. TI, or trachomatous inflammation, intense, involves pronounced thickening of the upper tarsal conjunctiva. The swelling obscures more than half of the normal deep tarsal vessels. This is a severe active infection stage with a high risk of scarring. TF requires 5 or more follicles. TI stands for inflammation intense and is the stage that obscures vessels. The follicle size in TF is greater than 0.5 millimeters. TS, or trachomatous scarring, is the presence of white fibrous bands, known as Arlt's line, in the tarsal conjunctiva. This indicates past or chronic infection, and the scarring leads to the contraction of the eyelid. TT, or trachomatous trichiasis, is defined by at least one eyelash rubbing on the eyeball or evidence of recently removed inturned eyelashes. This stage involves entropion and requires surgical intervention to prevent painful corneal scratching. CO, or corneal opacity, is the end stage, where the corneal opacity over the pupil is easily visible and dense enough to blur at least part of the pupil margin. This results in significant visual impairment, or total blindness. The correct answer for the serotypes causing trachoma is A, B, and C. Macallan's classification is an older system used before WHO FISTO. It describes 4 stages: incipient, established, cicatrizing, and healed trachoma, with the latter involving sequelae like trichiasis. Clinical symptoms include eye redness, watery or mucopurulent discharge, and a foreign body sensation like sand in the eyes. Photophobia, or sensitivity to light, and pain, especially in the TT stage, are also common. Diagnosis relies on clinical findings using the WHO grading. Laboratory methods include Giemsa stain to show inclusion bodies. PCR NAAAT is the gold standard for active infection, and immunofluorescence is also used. Differential diagnoses include conditions that mimic trachoma, such as viral conjunctivitis, which has follicles but no scarring. Bacterial conjunctivitis and allergic vernal keratoconjunctivitis, characterized by cobblestone papillae, should also be ruled out. Complications, or sequelae, ultimately lead to blindness. These include trichiasis, entropion, corneal ulcers, and corneal opacity. Xerosis, or eye dryness, also occurs due to goblet cell destruction. Trichiasis is the interning of eyelashes. Arlt's line is seen in trachoma scarring, and Herbert's pits are seen in trachoma at the limbus. Giemsa stain is the diagnostic stain. Medical management utilizes azithromycin as the drug of choice for mass administration due to single-dose compliance. The dose is 1 gram for adults and 20 milligrams per kilogram for children as a single dose. Tetracycline eye ointment is an alternative. Surgical management is indicated for trachomatous trichiasis, or TT. The primary procedure is bilamellar tarsal rotation, or BLTR, to direct the lashes away from the eyeball. Alternatives include electrolysis and cryotherapy for managing fewer lashes. The S in the WHO SAFE strategy stands for surgery for trichiasis. This immediate intervention, performed by trained personnel, is crucial to halt corneal damage. The A stands for antibiotics to treat active infection, TF or TI. Mass drug administration with azithromycin is recommended for the entire community if prevalence exceeds 10% in children. The F represents facial cleanliness. Promoting face washing in children removes ocular discharge, which is food for flies, thereby reducing transmission. The E stands for environmental improvement. This involves providing access to water and sanitation, fly control through proper waste disposal, and reducing overcrowding. The correct answer for the drug of choice in mass drug administration for trachoma is azithromycin. The correct answer to the question regarding WHO grading indicators of active infection is trachomatous follicles. Trachoma control was integrated into the National Program for Control of Blindness and Visual Impairment in 1976. Trachoma is no longer a leading cause of blindness in India, with cataract and refractive errors being more prevalent. As of 2024, India has met the criteria and been declared free from trachoma as a public health problem by WHO. Surveillance continues to prevent reemergence. Nursing management includes assessment of the eyes for follicles and redness, administering azithromycin or tetracycline ointment, and teaching correct hygiene techniques like face washing. Post-operative care after trichiasis surgery is also essential. The S in SAFE stands for surgery. The vector is Musca sorbens, the fly. The adult dose for azithromycin is 1 gram stat. The WHO grading name is Fisto. A summary of trachoma includes agent, chlamydia trachomatis, grading, Fisto, strategy, SAFE, treatment, azithromycin, surgery, tarsal rotation, and status, eliminated in India. The mnemonics Fisto and SAFE summarize the WHO grading and strategy for trachoma control. Remember to focus on the goal, not the obstacles. Thank you for watching this video. All the best. Thank you for watching this video.